Hello class, and welcome to your Chapter 7 lecture. Today we're going to be discussing alcohol, looking at the pharmacological effects. So the learning objectives for this lesson are that by the end, you should be able to explain the pharmacokinetic properties of alcohol and how they influence the effects of the drug, explain the role of alcohol in polydrug abuse, identify the possible physical effects of prolonged heavy ethanol consumption, explain what alcohol dependence is and how it is treated, explain the potential cardiovascular benefits and problems of moderate alcohol use and the dose-dependent nature of these effects, describe the cause and effects of fetal alcohol syndrome, explain how prolonged alcohol consumption affects the brain and major organs, explain why alcohol use by adolescents and college students is concerning, and finally, explain why malnutrition is so common among alcoholics. So for a little introduction here, in 2015, sales of alcoholic beverages in the United States totaled $266 billion. In 2018, 20% of high school seniors reported that they had been drunk at least once in their life, and roughly 14% of high school seniors reported to binge drink. Over 1 million people every year will receive treatment for alcoholism. And due to frequent advertising, alcohol use is considered acceptable and even desirable in our country. So let's look at the nature and history of alcohol. So how is alcohol made? We need to combine sugar, water, yeast, and warm temperatures, and voila, you have alcohol. So alcohol is produced by a single-celled microscopic organism, one of the yeasts, that breaks down sugar by a metabolic form of combustion, thereby releasing carbon dioxide and forming water and ethyl alcohol as waste products. Fermentation continues until the sugar supply is exhausted or the concentration of alcohol reaches the point at which it kills the yeast, typically 12 to 14%. So interestingly, animals will actually seek out fermented fruit, and it has similar effects that humans will experience. So fermentation is the natural biochemical process through which yeast converts sugar to alcohol. And mead was the first alcoholic beverage and is simply fermented honey. Interestingly, Egyptians, Greeks, and Hebrews all drank wine, so alcohol has been around for quite some time. So a distillation device, or a still, was developed by the Arabs around 800 AD, and then it was introduced to Europe around 1250 AD. So they boiled fermented drink and gathered the condensed vapor in a pipe, which increased the alcohol content to 50% or higher, which also then led to increased alcohol abuse problems. So it wasn't until the 1930s that alcoholism was considered a medical condition that required treatment. So when we look at alcohol as a drug, it is the number one abused drug. 5.3% of the population 12 years of age and over have an alcohol disorder. It is the third leading cause of preventable death. The psychoactive substance that depresses the central nervous system while influencing nearly every major organ system. It is addictive. It produces both physical and behavioral dependence. And tradition and attitude are two very important factors in helping to determine use patterns among a person. So a few other statistics: 12% of children will grow up with a parent with alcohol problems, and more than 50% of American adults have had a history of problem drinking. Unfortunately, when we look at treatment, the relapse rate after treatment is between 40 and 60%, so it's very high. Then looking at alcohol as a social drug, it has been described as a social lubricant, which is simply the misconceived perception that alcohol promotes social interaction and bolsters one's confidence by repressing inhibitions and strengthening extroversion. Some of these reasons for this misconception are legal reasons, being used before going out with friends to improve one's mood, reduce self-consciousness, or enhance your social skills, to improve social bonding. It's been thought that alcohol can improve empathy and friendliness in people, reduces one's social fears for those who have social anxiety because it's lowering your inhibitions. And then it mitigates effects, again here, of social anxiety disorders. So what impact does alcohol have? Well, first it has some adverse pharmacological effects. So these adverse pharmacological effects can cause alcoholism, death, and financial costs to society. So some of these financial costs include the fact that 72% due to workplace absenteeism, workers' compensations, Social Security disability, and unemployed expenses. 11% has been associated with healthcare expenses, including emergency care, hospitalizations, treatment of alcohol use disorder, and the treatment of cirrhosis. 10% as it relates to criminal justice expenses, and 5% comes directly from motor vehicle crashes and associated insurance expenses. It can cause severe dependence, disruptions to personal, family, social, and professional functioning, as well as illness and accidents. So alcohol use is linked to about 5% of cancers, and heavy long-term use can cause cancer of the mouth, gastrointestinal tract, liver, and the breast. And then it's links to violence and crime. So let's discuss more of how alcohol affects crime. So alcohol is strongly associated with crime and social problems. The use of alcohol contributes to 40% of all violent crimes. And those violent crimes include robbery, sexual assaults, aggravated assault, intimate partner violence, child abuse, and homicide. In 2/3 of violent crime cases, the attacker and the victim were acquainted. 37% of approximately 2 million incarcerated offenders in the United States reportedly were under the influence of alcohol at the time of their arrest. More than 1 million are arrested each year for DUI of alcohol, and 40% of all traffic deaths are alcohol related. 95% of violent on-campus assaults at colleges will involve the use of alcohol, and less than 20% of those incarcerated will actually receive adequate treatment. 95% are going to experience relapse, and 70% are going to recidivate. So when we're thinking about alcohol and how it's related to crimes, and then the treatment that those criminals are receiving for their alcohol issues, it's not adding up. So let's look at now teen and college student drinking. So Alcopops some examples are Smirnoff and Bacardi. These are described as those sugary, fruity, malt-based drinks that are in those brightly packaged packages that are supposed to attract adolescents, even though the distributors are going to say that it's not. That's who it appears they're geared towards. So these cause greater harm to teenage users who either drink more per day and on more days, those who binge drink 4 times more often, and engage in physical altercations resulting in injuries that require medical attention. So heavy alcohol use luckily showed that decreased 10% between 2012 and 2018 for 12th graders. The 2018 are the last statistics we have for that. So when we look at then consequences for college students, about 58% of full-time college students report to drink alcohol, and 12% report that they binged on 5 or more days in the preceding month from when the study was conducted. We see 1,600 deaths of college students, 700,000 assaults, 97,000 sexual assaults. So you can see that underage drinking and college drinking is a huge issue. So youth who start drinking at an early age will have an increased likelihood of developing alcohol dependence into adulthood due to an altered expression of their genes and interference with normal development of those critical brain systems. Youth who start drinking at an early age are also more vulnerable to effects of other drugs. They may develop mental health problems as a result. So nearly 50% of students report to consume alcohol, and 34% report that they have been drunk before graduation. So recommendations for physicians, they say that physicians should screen adolescent patients for alcohol use. So make sure that they're checking in with their adolescent patients to see if they're using or abusing alcohol. Discuss the hazards of use with their patients who are underage. And encourage the parents to be good role models because they believe that parents are key in preventing alcohol use in children. And finally, to support the continuation of 21 as the minimum legal drinking age. So what are the different types of alcohol that we have seen? So the first type is your poisonous type, which is methyl. This is a poisonous alcohol that's made from wood products. Ethylene glycol is used in antifreeze, so these are all poisonous types of alcohol. Isopropyl is rubbing alcohol or an antiseptic. And then your non-toxic are going to be your pure ethyl alcohol or ethanol, which is recognized as an official drug, but not for medical use. So this is used as a solvent for other drugs or as a preservative. It's been used to clean, disinfect, as a bactericide, injected in or near nerves to treat severe pain, for local anesthesia or deterioration of nerves, and it's used in alcoholic beverages. So the British military, this is where proof of alcohol comes from. So the British military placed a sample of liquor on gunpowder and touched a spark to it. If it ignited, then that meant it was over 50% alcohol. If not, then it was less. So this was the test that they used to show proof of the alcohol content, which is where we get proof from. So what are some physical effects that we see from alcohol? The chart on the left is a really good breakdown and just visual to show you, but we're going to walk through it. So the brain is quickly affected by alcohol because of the high amount of blood that's contained within the brain. So alcohol is metabolized by an enzyme, alcohol dehydrogenase, which is found almost exclusively in the liver, which is why you see those who are alcoholics with such bad liver damage. It can also act as an anesthetic, so it blocks sensitivity to pain. Effects on one's body is going to depend on the blood alcohol concentration, or BAC, which is simply the amount of alcohol in the blood. This is going to determine the physical and behavioral responses that one has. So these different factors are going to affect how your BAC presents. So the presence of food in the stomach, the rate of alcohol consumption, how fast are you drinking, how much, your body composition. So greater muscle mass is going to be equal to lower blood alcohol content because muscle carries more fluid than fat does, which is why women typically will have a higher BAC quicker than men, because women typically have higher fat content while men generally have a higher muscle content. As well as just the concentration of alcohol. Again, what proof are you drinking? Is it a very strong concentration or is it a lower? And the circumstances that drinking occurs in is also going to affect the physical effects that one will experience. So the drinker's mood, attitude, and previous experiences that have contributed to their behavioral reaction. So without knowing, some individuals will start acting drunk when they take the first sip of alcohol because that was their previous experience. It's almost a learned behavior. So it's important to know, though, that diluting alcohol with water can slow absorption, and mixing carbonated beverages will increase absorption because it pushes the stomach contents into the small intestines more quickly. So let's look at metabolism. So one of the physical effects is on your metabolism. So your blood alcohol content rises proportionate to the amount of alcohol that's consumed because the liver metabolizes alcohol at a slow and constant rate. When we talk about tolerance, chronic users may engage in behavioral tolerance, which is modifying patterns of behavior to compensate for motor impairments. So you're a little bit under the influence, you're a little bit tipsy, maybe you're not walking in a straight line, so you're going to try extra hard to make sure that you're walking straight. So you're using this behavioral tolerance, you're modifying your pattern of behavior to compensate for those impairments you're experiencing. So tolerance results in increased rate of alcohol metabolism and a reduced response by neurons and transmitter systems by increasing activity of the inhibitory neurotransmitter GABA to alcohol. When we look at dependence, psychological dependence can result in addiction to alcohol. So those who are addicted are considered alcoholics. Genetics, again, can account for 50% of a person's risk to develop alcoholism. So men are actually more likely to develop significant dependence. And then with some of the withdrawal symptoms one may experience include anxiety, restlessness, irritability, insomnia, chest tightness, muscle tension, tremors, shakes, sweating, and even tingling. The relapse rates for those less than a year is about 20%, and after 5 years, it's 15%. So the longer one goes without drinking, lower the chance of relapse. Now, when we look at treatment, we have 4 approved treatments. First is antabuse, which will actually make the user sick and nauseous when they consume alcohol because it interferes with the metabolism of alcohol. Naltrexone is an opiate antagonist that relieves alcohol cravings and reduces relapse rate. So roughly 20% of the population have a positive response, but 80% will have no response to naltrexone. Camprol is also used, which blocks release of exciting neurotransmitter glutamate and reduces withdrawal in abstinent alcoholics. And then topiramate has also been approved, and it's currently being considered, by the FDA for treatment. So sometimes it's used for off-label purposes, which this would be one of them. So it increases the GABA inhibitory transmission and reduces glutamate stimulatory transmission. When we then look at those who have polydrug use, who use more than one drug. So polydrug use occurs because it enhances the reinforcing properties of other CNS depressants. It also decreases the amount of expensive or difficult to obtain drugs that are required to achieve the same effect. It can diminish unpleasant side effects of other drugs of abuse, such as withdrawal from CNS stimulants, and those who have a common predisposition to use alcohol. So it intensifies intoxication and can also diminish unpleasant side effects of other drugs of abuse. Those are the 2 important points to remember. So what are some short-term effects of alcohol? At low to moderate use, disinhibition will occur. This is a loss of conditioned reflexes because of depression of the brain's inhibitory centers. So we'll have some euphoric effects and talkative. Others can become aggressive and hostile. It will interfere with motor activity, reflexes, and coordination at this level. Moderate to high levels will lead to increases in heart rate, dilated blood vessels. It can moderately lower blood pressure and stimulate appetite, but can also cause trouble walking, talking, thinking, and it will induce drowsiness. And then at lethal levels, it can cause death by severe depression of respiration centers in the brainstem. However, people will usually pass out before they reach the lethal level. So when we look at hangover can include fatigue, nausea, upset stomach, headache, sensitivity to sound, and an ill temper. If you've ever drank too much or seen someone who's drank too much, they're not too happy. So some of the theories of the causes of hangovers are an accumulation of acetaldehyde, dehydration of tissues, poisoning because of tissue deterioration, depletion of important enzyme systems, acute withdrawal or rebound responses, and metabolism of impurities in alcoholic beverages. So hangovers occur because the body is going to lose fluids through the alcohol's diuretic action. So the water content in alcohol drinks increases the volume of urine. Alcohol also depresses the center in the hypothalamus that controls the release of water conservation hormone, which means less hormone is going to equal more urine volume being increased. So we're losing a lot of fluids. Alcohol is actually related to genetics. So genetics account for roughly 50% of a person's risk to develop alcoholism. Genetics influence neuronal feedback that signals the body to stop drinking. It can influence the level of pleasure that one experiences from drinking. It can influence the frequency of one's use and the differences in intensity that a hangover that a person will experience. So inherited genes that contribute to alcoholism can cause excessive consumption, a dampening of neuronal feedback, and enhanced pleasure from drinking. So supportive and healthy environments can actually act to counterbalance hereditary and genetic influences, which is very important. So let's look at the effects of alcohol on our organ systems and our bodily functions. We're going to start with the brain and the nervous system. So those who routinely drink more than 14 drinks per week lose approximately 1.6% of their brain size compared to non-drinkers. When we look at low to moderate doses, it suppresses subcortical inhibitions of cortical control centers, resulting in disinhibition, and increases the release of endorphins, contributing to rewarding properties. High doses depresses the cerebellum, causing slurred speech and a staggering gait. In extremely high doses, alcohol depresses the respiratory centers of the medulla, resulting in death. It also alters production and functioning of transmitters, such as dopamine, serotonin, GABA, and irreversible damage to the brain and peripheral nervous system, leading to permanently compromised mental functions and memory. Looking at the liver, you'll see a healthy liver and a liver that has severe alcohol abuse and damage. So alcoholism accounts for 60 to 80% of liver-related deaths in high-income countries. So those who live in high-income countries, typically our liver should be nice and healthy. We have no reason for it not to be, except when one's consuming large amounts of alcohol. So you can have a hepatotoxic effect, where the liver cells increase production of fat, resulting in an enlarged drinker. This can be caused by 5 to 6 drinks per day for several days by males, or 2 drinks of hard liquor a day for several days in females can cause this effect. It is reversible, however, if the drinking stops. Alcohol hepatitis is chronic inflammation of the liver resulting from irritation and swelling. This also is reversible if the person stops drinking, but it can still be fatal if the person does not. And cirrhosis of the liver is not reversible and it is often fatal. So this is fibrous scars that form on liver tissue, causing the liver to harden and then also causing deterioration of the function tissue. Looking at the digestive system. So the digestive system is going to include your mouth, the pharynx, esophagus, stomach, as well as small and large intestines. So due to an acid imbalance, inflammation, and acute gastric distress can result in gastritis and heartburn. Cancer of the mouth, esophagus, and stomach can also result, as well as ulcers, a hiatal hernia, and we can also experience pancreatitis, pancreatic cirrhosis, and alcoholic diabetes. So this is how alcohol affects the digestive system. When we look at our blood, alcohol diminishes effective functioning of the hematopoietic system, which is your blood building system. It decreases production of red and white blood cells and platelets. Issues with clotting can result issues with clotting then can result in bleeding disorders. So you're more likely to bleed, how to explain this? You're more likely to bleed quicker and more when you have alcohol in your system. It also results in suppression of bone marrow, which contributes to anemia. So bone marrow is where different blood cells are actually formed. And finally, a lowered immunity to infection, which can result in a low resistance to fighting other diseases. Looking at the cardiovascular system, 20 to 40% reductions in heart attacks, strokes, and high blood pressure is seen in low to moderate drinkers. And this can be the result of, or may be related to, stress relief and increases in blood concentration of high density lipoproteins, or because moderate drinkers tend to live healthier lifestyles aside from the drinking. Chronic intense use actually changes composition of the heart muscle and can result in alcoholic cardiomyopathy. So this is congestive heart failure resulting from replacement of the heart muscle with fat and fiber. So when we look at the possible positive effects that alcohol can have on the cardiovascular system, it can have cardiovascular benefits for men 50 years of age and older, or post-menstrual women. And high density lipoproteins are actually used to transport fat through the bloodstream. So these levels are negatively correlated with cardiovascular diseases. So that's why there's arguments that sometimes moderate drinking can lower your chance for cardiovascular diseases. And it's important to note that moderate drinking is defined as 1 drink a day for women or 2 drinks a day for men. So alcohol can also cause irregular heartbeat or an arrhythmia, high blood pressure, and even stroke. Now moving to the sexual organs. So alcohol can interfere with sexual functioning, and continued use can cause prostatasis or atrophy of the testicles. So it's an inflammation of the prostate gland and it interferes with the ability to maintain an erection. Atrophy of the testicles will result in a lowered sperm count and diminishes hormones in the blood. So you see how alcohol is affecting nearly our entire body. Moving then to the endocrine system, alcohol alters the endocrine functions by influencing production and release of hormones. So endocrine glands release hormones into the bloodstream. And hormones function as messengers that directly affect the cell and tissue function. So it can also affect endocrine regulating systems in the hypothalamus, the pituitary, and gonads. More on the endocrine system here. We look at men and women differences. These are the different effects that you'll see. So in men, these effects can look like sexual impotence, breast enlargement, and loss of body hair. For women, you can see menstrual delays, ovarian abnormalities, and even infertility. Moving on to the kidneys. We can see a decrease in kidney function, which diminishes the organ's ability to process blood and properly form urine, and a greater number of urinary tract infections. So now that we're done with the effects on the entire body, we'll look at some mental disorders and damage to the brain. So those with mental disorders are likely to have alcohol problems because alcohol affects functions of parts of the brain that control emotion and social behavior. Long-term heavy use affects memory, judgment, and one's learning ability. So Wernicke-Korsakoff's syndrome is a psychotic condition caused by alcohol use and is associated with nutritional and vitamin deficiencies. So this is a degenerative brain disorder, and symptoms of this can include confusion and even memory loss. Looking at a few other impacts of alcohol abuse, let's look at effects on the fetus. So alcohol can cause spontaneous abortion and even fetal alcohol syndrome. Sorry, that should say fetal. So fetal alcohol syndrome can cause physical effects such as facial deformities, growth deficiencies, mental retardation, as well as joint and limb abnormalities. So alcohol consumption is actually the leading cause of mental retardation and congenital defects in children. Looking at gender differences, women will metabolize alcohol more slowly than men. So women actually have higher percentage of body fat, which means we retain more of the drug. So heavy alcohol use in women can cause accelerated damage then to the brain, liver, heart, and one's muscles. Treatment for women. So women will typically have a later onset of use and associated problems with alcohol. They also typically have more positive family history, more marital disruption. They will also experience anxiety and stress. So malnutrition, this is our final impact of alcohol we're going to cover. So malnutrition, alcohol are empty calories. So alcoholics will typically consume 300 to 1,000 calories per day. So alcoholics are not getting enough vitamins, minerals, proteins, or fats. And the gastrointestinal tract damage from drinking can also damage the lining of the stomach and intestines, which also interferes with proper absorption of essential nutrients. So even when an alcoholic does eat a meal or does decide to consume essential nutrients, because of the damage they've done to their intestinal tract, they may not be getting the proper nutrients and absorption from them anyway because of all that damage. So for an alcoholic, 50% of their calories will typically come from alcohol. So in sum, alcohol is a CNS depressant affecting mental and physiological functioning. There are four types of alcohol. Four types of alcohols are methyl, ethylene glycol, isopropyl, and ethanol. One's blood alcohol content depends on the presence of food in the stomach, the rate of alcohol consumption, the concentration of alcohol, and the drinker's body composition. Low to moderate doses will interfere with motor activities, reflexes, and coordination. Moderate doses will slightly increase the heart rate, dilate blood vessels, and lowers blood pressure while increasing one's appetite. High doses will stimulate urine output and causes difficulty walking, talking, and thinking. Alcohol is commonly used with other drugs to enhance reinforcing properties, reduce the amount of the expensive or hard-to-get drug that is needed to experience the high, reduce unpleasant side effects, or because a predisposition to use drugs exists. And dependence on alcohol can result from long-term heavy use and is treated by antabuse, naltrexone, and Camprol. Remember, the fourth one is not officially approved yet by the FDA. Alcohol may also have cardiovascular benefits for men over 50 and postmenopausal women. Women who drink heavily during pregnancy can cause fetal alcohol syndrome in their fetus. Long-term heavy alcohol use causes serious damage to nearly every organ and function of the body, including the brain, liver, kidneys, cardiovascular system, nervous system, endocrine system, blood, digestive system, and sexual organs. If you remember anything from this entire lecture, it is that alcohol affects your body from head to toe. And youth who begin using alcohol at an early age have an increased likelihood of developing alcohol dependence in adulthood, are more vulnerable to the effects of other drugs, and may develop mental health problems. And finally, malnutrition is common among alcoholics due to decreased caloric intake and diminished consumption of essential nutrients. So that was your Chapter 7 lecture. As always, if you have questions, please reach out. Hope everyone has a fabulous week.